We'll start in a few seconds.
Good to go.
Hi, good evening, everyone. Welcome back to the Community Recovery Advisory Group meetings. This is our March 2021 meeting. I also want to remind everyone that today is International Women's Day. Congratulations to all the women on the call. I had the honor to be part of a Zoom session that just ended with Madam Secretary Madeleine Albright, and it was hugely inspirational. She just shared so much wisdom from her experiences. And I wanted to share just a couple of things with you. So I'm trying to make some connections between her world and what she talked about and our agenda for this evening, which is vaccine communications. So just want to share some pearls of her wisdom that I think relate to our topic of the agenda today. She, among the many things she talked about, was the importance of being succinct and being able to communicate in a way that others can understand. And she said that I felt that long academic discourse didn't explain well enough to the public what was going on. It's a good idea to try to state things in a way that's comprehensible to people without lowering the seriousness of what's going on. So I'll leave you with that. And I'd like to transition to the chair of the CRAG, Mr. Elijah Wheeler.
Thanks, Adriana. Good evening, everyone. Hard to follow that, Adriana. I want to say the same thing. Happy International Women's Day to all the women who are joining us on the call here this evening. We should be reminded of the contribution you all have made here in this world. After all, none of us would be here if not for a woman whatsoever. We have to make sure that the work that we do day in and day out is not relegated to a simple day or a month in honoring you all's presence. So thank you for that, Adriana. That's an important reminder. Quickly, as we get ready for this evening's meeting, just a quick overview of who the CRAG is. A reminder that as a Community Recovery Advisory Group, you all are trusted representatives of communities severely impacted by the pandemic, as well as community members who are subject matter experts on issues relevant to recovery. You are here for three specific reasons: to convey the needs and challenges of Montgomery County communities, provide input on the recovery process for Montgomery County, and provide the community's information about the recovery process that the county is going through currently. With that being said, before we get into our guests this evening, Diane Vu from the Office of Community Partnerships, Sean Ellis, and Ken Hartman Espada, I'm going to turn it over to Dr. Earl Stoddard.
Good evening, everyone. Welcome back. I appreciate you continuing to come back and provide us good feedback and commentary on what we're doing to respond to and recover from COVID-19. I just have a few things I want to touch on this evening before we get started. So first off, on the COVID-19 front, we are making good progress in reducing the spread of COVID-19 within our communities. Our community is entirely to thank for that. They followed the guidelines set forth by Dr. Gales and enacted through executive order by the county executive and the county council. Right now, we are averaging right around 100 cases, give or take 10 or so on any given day. Our test positivity is down around 2.9 to 2.8 on most days, which is great. We continue to see, obviously we're seriously monitoring the state's tracking of the variants within our communities. We are seeing in several states that the variants are taking over as the dominant strain, even as we aren't quite seeing that yet in Maryland. We know that it will happen. There's no reason to believe that the variants will not spread in Montgomery County, in the state of Maryland, in the country. Generally speaking, we all know this to be true. The country has not taken a zero COVID stance. We've taken a mitigate the impacts of COVID-19 stance. And so we would expect the variants to spread as freely as the virus itself has in the beginning. On the vaccine front, obviously the county has moved to our further along into our phases for vaccine tiers. We have included all of phase 1B, including our essential workers. And we have also moved into 1C, particularly the first phase, which is focused on 65 to 74-year-old adults. We are pretty much mostly in line with where the state is at this point. And so obviously getting people vaccinated is sort of the key and the focus of what we're doing. We're getting about 4,500 doses per week. on average. Last week we did get the Johnson & Johnson doses, about 1,600 of them. We're not getting more this week, nor are we getting more next week based on what we've heard from the federal government. So we're really stuck at that 4,500 doses a week at the county level. And that's augmented by what the hospitals, pharmacies, and the mass vaccination sites put out. We continue to work with the state on trying to encourage them to develop a mass vaccination site in Montgomery County. To date, we have not been successful in doing that. The state is listening and they have not said no, but obviously they're focused on the rollout of their existing sites. The next three, the one that Waldorf just opened, they've got the one in Western Maryland, one in Wacomico counties as well. As we've been touting, those are in smaller counties than pretty much any congressional or even council district in Montgomery County would be if it were its own county. And so obviously that's something that we've been really focused on. We do have more meetings scheduled with the state this week to discuss mass vaccination sites. So they're listening. We're continuing to do the work to lay the groundwork so that all they'd have to do is commit to providing us the vaccine. And we would serve as a mass vaccination site for both Montgomery County as well as our partners in the area. We're currently looking and focusing on Montgomery College Germantown's campus, given that it is in a high risk zip code. It would also support vaccination for Frederick County as well, given that it's right off of 270. The college was a willing partner, and that we have other sites spread around the county that we can use for other purposes, but the mass vaccination, the size and capability and location made the college campus a very attractive target for us. So that's sort of the lay of the land where we're at, but obviously sort of as a prelude to the conversation we're gonna have today around vaccine communication, vaccine hesitancy. For those of you who did not see the Goucher polls that came out, really March 1st polls when they were conducted, really interesting results around vaccine hesitancy. I think in the state of Maryland, about 64% of all residents said that they're prepared to take the vaccine, which is up from about 50% when they measured this, I think a couple months ago, late winter, early fall, something like that. Or late fall, early winter, I should say. The highest demographic that is least likely to take the vaccine is actually those who self-identify as white Republicans. Not what we often talk about with our Black and brown residents. There's still hesitancy in all categories that we're going to have to address, but obviously the narrative that has been put out there is not necessarily representative of what people are telling, certainly polling places on the ground. And so we have a lot of work to do to get people to take the vaccine across the board, but obviously we've got an effort that Diane Vu, Ken, and Sean will be talking about tonight. So thanks for that, and turn it back over to you.
Thanks, Earl. Appreciate the update. Really important information there. So obviously this evening we are talking about the vaccine rollout and communication efforts to our diverse communities here in Montgomery County. I think we're going to start with Diane, who is the Director of the Office of Community Partnerships. Diane, thanks for joining us here this evening. Looking forward to engaging in a good conversation with you and Ken and Sean.
Well, thank you so much for having me here. It's good to see so many of our CCC members on this call. So I apologize that some of this stuff is going to be repetitive, but know that you're obviously playing a very critical link. Even if you're not involved in the CCCs, you're going to learn more about it tonight. So you can hear more about how you can continue to get involved outside of this committee. So I'm going to share my screen. We have a very short presentation, and Ken Hartman is going to start it.
Good evening, everyone. Diane, thank you so much for running the slides, and we'll be tag teaming. I wanted to say that I'm the goose to her maverick, but then I always remember what happened to the goose in the movie, so I try to avoid that metaphor. But we're a team. We work on this together and complement each other and chip in as much as we can to help move this forward. So to understand this what we're doing now, we put together this brief presentation. We'll talk about where we've been and then end with where our judgment on where we ought to be in the future coming out of COVID, because I know we're all focused on recovery and building back better. When got into COVID-19, and Diane and I were assigned this duty of multicultural and multilingual communications. The immediate 3 issues that we tried to address was, of course, communicating in 7 languages. And one of those 7 languages, of course, is English. To populations in Montgomery County where there may be a trust barrier. And let's face it, not all of us see government as a problem solver. And in many of our experiences, government could be the problem. So overcoming that trust barrier among our residents. And then, of course, overcoming the technology gap. And not everyone has a desktop computer, and not everyone watches cable news at night. So figuring out how to get the message to our populations in a way that is most convenient and familiar to them. When we started, we created a framework, and this is these are the 6 areas that we're still focused on today. But the first thing we did was establish translation teams. We redeployed county staff who had an expert level of language skills. They had been tested at that level. We deployed them into teams to help us translate material into Spanish, French, Amharic, Chinese, Korean, and Vietnamese. And these teams, we still have these teams working today, and we're looking towards a more permanent scenario. We began town hall meetings, particularly in the African American and Latino communities. We also work with partners to conduct town halls in Amharic and other languages. We created social media accounts. Today we now have a county government Facebook page in Spanish, and we have a wildly successful WhatsApp account where information can be disseminated in Spanish through that platform. We began partnerships through our nonprofit partners and our health initiatives. The 3 health initiatives, the African American Health Partnership, the Latino Health Initiative, and the Asian American Health Partners work hand in glove with us, and we communicate frequently and provide information and in order to get the message out to those communities and to serve them better. And that leads to coordination of all these groups that we need to work with. Both internal and external require a great deal of talking and planning and communication. So we are in constant coordination with all of our partners to move this effort forward. And then Diane will talk about what we call the CCC framework. Of course, many of you know what this is, but I'll turn it to her to describe what that is.
Thanks, Ken. So Ken gave a really good overview of kind of the aerial level view of the work that the county has been doing in partnership with many of you. But let's talk about the CCC, because this is kind of central and key to a lot of our education and outreach. So the CCC stands for the Census Complete Count Committees. Every jurisdiction stood up a complete count committee in preparation for the 2020 census. The purpose of the committees is to develop and implement education and outreach strategies with a focus on targeted census tracts and historically underaccounted communities. Most jurisdictions, the size of their CCCs is or was anywhere between 15 and 25. Our CCC was 142 people strong. And the reason why we went with that approach is because we really wanted an all hands on deck type of approach. We knew going into the 2020 census, even pre-COVID, that we were going to have a very huge task in front of us to overcome the tech barriers, to overcome the challenges that the federal government at that time was putting out. And we really needed all hands on deck and as many trusted voices in the community communicating the importance of being counted. So the larger CCC was broken out into 5 regional subcommittees that were chaired by the regional service center directors and co-chaired by one of our office community partnerships community liaisons. The reason we did that is so that we could take a very granular approach to our education and outreach, and so we could also tailor our strategies based on census tracts and also demographics as well. So for example, when we looked at East County, right, the East County subcommittee looked at, you know, which grocery stores were in East County, what languages were spoken in that area, what other assets we had in East County, nonprofit organizations, so that we could tailor our messaging to those communities and also help us get us on the ground. It required a lot of coordination, as you can imagine, and as you heard Ken say, across government agencies such as the Public Information Office. I see Barry Hudson on the call today. Hi, Barry. HHS, OEHMS, because we realized very early on that there was significant overlap between communities that we were trying to target to encourage to respond to the census, and also between communities hardest hit by COVID. And so we very early on tied our COVID outreach with census, and as we approached election day, we also tied in voting information as well. And so many of you saw that we developed and distributed multilingual flyers. We did mailers in 7 different languages. There were door hanging in specific communities. We had multilingual lawn signs that were in specific census tracts. Newspaper ads, radio, TV. We really increased our social media presence through, Facebook, WhatsApp, and now we're looking to expand to YouTube and also Twitter as well. We also did very targeted text messaging, and we'll talk a little bit more about that later. And also our nonprofit partners helped us with phone banking as well. So we really did everything that we could to get into people's homes, because we knew that the traditional methods of education and outreach would not work. And so again, we spent 12 to 18 months doing everything that we could to get into people's homes. We also did almost 400 in-person community events, and it all paid off. I mean, you all know this, we ended up with a self-response rate of almost 2 percentage points above where we were in 2010, which in this climate was a phenomenal feat, and many of you were a big part of that. And so because of the success of the census, because of the number of partners that were involved, because of the very targeted strategy that included multilingual and multicultural communications, we're going to continue to stand that up through the COVID response. Right now, obviously, the conversation is around vaccines, and then we're going to continue standing that up post-COVID. One of the great things about the subcommittees is the conversations around these targeted messages, and also in-person events. Like I said, we did almost 400 in-person events over the course of 12 months with your support, and also with support from our nonprofit partners and our census ambassadors. So we're continuing to stand that up, right, as we move through COVID response. And Sean Ellis, who many of you know, has been running all of the multicultural, multilingual communications and outreach out of my office. And I'm going to let Sean highlight something that happened on Saturday, which came about as a result of the foundation that we created for census, and also came out of the Bethesda Chevy Chase subcommittee. Sean?
Thank you, Diane. So as Diane just mentioned, this weekend we had an opportunity to host our first in-person community outreach event. This specific outreach was born out of discussions from the Bethesda Chevy Chase subcommittee. and really driven and motivated by Reverend Moultrie from Mount Calvary Baptist Church. That community in and around Lincoln Park, we had identified as being one of those communities significantly hit by COVID, but also had a low rate of pre-registration. So partnering with the city of Rockville and Reverend Moultrie, discussions led mostly by Ken and I, focused around how we could do outreach, get as many folks in those communities or in that community specifically pre-registered, just in case we had an opportunity to stand up a vaccination site down the road. So what we did was partner with Reverend Moultrie, and he was really adamant about the urgency and not waiting too long to get an event off the ground. So because of that urgency, we actually printed 2,400 door hangers, and last Tuesday and Wednesday, hung those in the surrounding community around Mount Calvary Baptist Church. Now that's slightly different from what we've done with the census. With the census over the last year, most of our community outreach was tied to existing food distribution events or pop-up tents at international grocery stores or high traffic shopping centers. This was slightly different from what we've done in the past, but because we were trying to target that specific community, and we felt like there was a need to get as many folks in that neighborhood pre-registered as soon as possible, we took a slightly different approach. So really the effort was manned by volunteers from the MRC. We had a total of about 31 volunteers on the day. Half from about half came from MRC, and the other half from the membership of the church. We stood up 2 info sessions or orientations to give the folks participating in Saturday's event a basic understanding of what we were trying to accomplish, what our goals for the day were, and what our expectations were in terms of social distancing and safety and all of that. So what's important to know is specifically for this event on Saturday, it was entirely outdoors. It was a drive-through pre-registration assistance event. We had one section where folks who weren't able to drive over could walk up and get help as well. And then inside, we actually, I know I said it was entirely outdoors. We were able to man 2 phone stations inside for folks who weren't able to make it in person on the day, but still needed some assistance in getting pre-registered. We had language support from Spanish-speaking volunteers, Mandarin-speaking volunteers, I think 1 French-speaking volunteer, and 1 person who spoke or was able to do American Sign Language. So from that perspective, the structure and the framework for what we want to do moving forward, I think was relatively successful. What I would say is this was the first of our events for what is this new effort that we're engaged in. I think one of the learning pieces, or one thing we will learn from this Sunday or the Saturday, is that it probably makes sense moving forward for most of our community outreach to be partnered with an existing events for the community. Because on Saturday, while we had an initial rush or surge of folks looking for support, it died down as the day went on. And so if we want to have the impact that we're looking to have, it probably makes sense moving forward to go back to that framework that was so successful for us over the summer months. So for the most part, what I'd say is we are in a point, or the takeaway from this weekend's event is that we did a different style of promotion in terms of getting the word out to that community. That 2,400 door hangers that were posted in that community means that there was an opportunity for folks to be reminded that they need to pre-register and do it themselves, go online and pre-register themselves, or pick up the phone and call to get some assistance without having visited us or visiting us on Saturday. So what we don't know is if there's going to be a significant bump in that surrounding community just based solely on the promotion efforts that went into preparing for this event. But I guess the biggest takeaway from this weekend is this is for the most part, going to be what we look to do with our community partners moving forward. We're looking to identify opportunities, especially in those communities that we know have been impacted severely by COVID. And when we know Black and Brown communities are under pre-registered, and then try to identify an opportunity to engage in this community outreach and get as many folks both educated around what they need to do in order to get a vaccine, and also pre-registered into the county's system if possible. So what you hear us talk about, I guess, for the remainder of this conversation is what that partnership is going to look like, what we're asking folks, and how we intend to go about being most effective in getting as many folks as we can vaccinated over the next upcoming weeks and months.
Thanks, Sean. And so what's on your screen is examples of stuff you're going to see coming out of this work, right? It is this flyer that is on your screen is available both in person and electronically. It's multilingual. And there's also a QR code on it that people just scan. And so at these large scale events, you're going to see very large posters like we had for the census. So people can just scan the QR code safely from a distance and then pre-register. As Sean mentioned, really the communication that's happening right now is to encourage as many people to pre-register as possible. And then, you know, what Earl mentioned at the top of this call is very true in what we are seeing from our folks right now. We're not seeing so much of hesitancy around the vaccine as it is people wanting to understand what the vaccine process is like and getting pre-registered. And so we're pushing that. And we know that in 4 to 8 weeks, when hopefully more vaccines become available, we're going to have to pivot off of that and focus more around the vaccine hesitancy piece. But right now, we're really focused on encouraging as many people to get pre-registered as possible, and we'll need your help in doing so. So speaking of a few months away and after COVID, Ken, what are we trying to do after COVID?
So Diane, thank you so much for that question. It's the takeaways. Diane and I have talked about what are the 3 things that the county will need to learn and imbue in its organization as in order to address the gaps in communication that we saw coming into the pandemic. I think the first of the 3 is we really need to continue this unified communication strategy for not just COVID, but other health initiatives, other important public programs. The communication strategy around them need to consider the technology of our population, the culture, and the language barriers in order for us to address those gaps in knowledge that we've seen. The second would be that we need to continue that enhanced role of community serving organizations in the communication and provision of services to our many communities. I think the services hubs are an example. The beefed up health initiatives, the empowered health initiatives are another example of what's changed since the beginning of COVID. And the role of our nonprofits that serve communities in their language is also, as we've seen during the census, needs to continue under the CCC umbrella and moving forward. And then, of course, for many of you on the call, this continued use of our local community committees and ambassadors. The best people to get the word out are the people who are in a community, who know their neighbors, and we need to continue to employ that moving forward. Diane, did I miss anything? Any last thoughts?
No, I think you nailed it.
Oh, thank you.
We've done this once or twice, right?
Yes.
So, turning it back over to Chair Elijah.
Chair Elijah. Thank you, Diane. I appreciate that. And I'm going to ask to see our honorary guest, Chunkster, a little bit later on. this evening. For those of you all who know who Chunky is, he might be Montgomery County's mascot. He'll make an appearance after a while. Let's go to questions now. Once again, just reminding folks to either raise your hand on the screen physically if you have a question, or use one of the prompts, the raise hand prompt at the bottom of your screen, or simply enter your question into the chat section here. So we'll start with you, John.
Thanks so much, Elijah. I've surprise, 2 questions. One is honestly aimed at Earl, your group as well, with the communication piece. I know the focus is on registration and getting things done and getting people registered, and I appreciate that from the county's perspective. I know when we last time talked about people being registered and already vaccinated, that they would just move along on the list. And so my question to you all is, have you considered using something as simple as a Google form to collect information on those who are already registered to be able to bump them off? That's what MCPS did, I can tell you, with their employees. They sent a Google form out to all employees, and one of the choices was, I'm already got my vaccine, and it just made it easier. And so I didn't know if you had thought about that. And that the only reason I relate to that, to the entire piece, is that my sense from the community is not fully understanding the timeline, and that people are getting registered and they're registering, and then they're waiting and waiting and waiting. And that leads to a lot of frustration. So that's my first question, and then I'll pause and hopefully get a quick second one in.
Yeah, I see Barry turn his camera on too, so I'm glad, because I know it's a communications question. I'm sure he can answer some of this. So, so first off, we talked about this a lot in terms of the logistics of removing names, because a couple things. So we talked about doing, and we actually are doing, a text message to send out to people to have them, say, do you still need to be vaccinated, yes or no? And then we can use that to clear the opt-outs. Because we are using the state's Immunet system, which everyone has to enter into to sort of take people off the list that way. But we want to make sure that people could be, if they got vaccinated, for example, in another state, it wouldn't be in the state system. And so there are people who live in Montgomery County, who work elsewhere, who may get vaccinated through those sources. We know there's at least 10,000, for example, in the District of Columbia who've gotten vaccinated through that mechanism. And so we are looking at other methodologies to do what you've suggested. It is still a hugely human-powered, even taking from a Google Doc and removing list names that way, it's hugely inefficient. And we also, when we tested some of the conversation around removing people, having people self-remove, there was a little bit of confusion about, having people pre-register and then remove themselves, and it's a hard thing to message on that side too. And so we're going to continue to keep looking at it, but we've cut down our list substantially as a result of using the state's data to issue. Now, on the timing question, this is the hardest question to ask. Like, when will I be vaccinated with where I'm at? And here's the reality of the answer. We've been given 4,500 doses every week for the last 5 weeks. And so if I extrapolate out that we're going to get 4,500 doses for the next whatever many weeks, I can tell you that we have 180,000 people registered in categories 1B and 1C. And a good chunk of those still need to be vaccinated, particularly in the tail ends of 1B and 1C as it is. So if you're talking 100 and let's say we get 15,000 doses a week in Montgomery County across all the system, we're going to be in this phase for at least 10 to 12 weeks, let's say, just being conservative. I don't think we're going to be in this phase for 10 to 12 weeks. I think there's going to be an increase in federal vaccine. And so if I tell you it's going to be 3 months before we get to people with underlying health conditions, people will be justifiably very upset to hear that, when I don't actually think it's the truth. I think we'll be in this phase for 4 weeks, and then we'll move on to the next one, because we'll see an increase in vaccine. People get vaccinated through other mechanisms and such. So it's a really hard thing to message when we don't know what the time is, but we have every reason to believe it's less than what extrapolation of the current trend would tell us. And so I don't know if Barry wanted to add anything to that.
Yeah, I'll just, good evening, everybody. I just wanted to add a couple points to Earl.
So for Barry, you may want to, I think everyone should know who you are, but you may want to.
Okay. My name is Barry Hudson. I'm the Director of the Office of Public Information, just so everyone knows. So yes, the point that there are a couple things. One, we are sending out messages in two ways right now to people who have either pre-registered or who have asked to get weekly updates. So on Tuesdays, we send out a weekly update to those folks who have registered, kind of giving them some information on how the registration process is going, how the vaccination supply looks, and the like. And then last week, we began sending out messages to individuals who had pre-registered. So the challenge is to Earl's point, because we don't know how much vaccine we're going to get until recently. Frankly, we just learned, I think it was 2 weeks ago, that we were going to get 4,500 doses for the next 3 or 4 weeks. So that was kind of solid. But I think the other part is that we've also been doing quite a bit of work around equity, making sure that we are, vaccinating people based on equity framework. And, with the group we were doing until recently, the 75 plus, we've been pressing really hard to get those folks to come back in and get vaccinated. I think to your point though, what the tool that we've been using is, if I remember correctly, is a Microsoft tool that we're using that is kind of guiding on that. We do have and do know who folks are, because we're getting a lot of good demographic information on it. But based on the way we're scheduling and based on how we're doing this, it does make it a little harder for us to kind of tell people where they are in line. And that's been probably the biggest challenge. Plus, I think as people compare the process we do for pre-registration with the other means that they may get their shot, which may be pharmacies and the like, where it's kind of more sit on your computer and just plug in your stuff and you're in. Our process is really much more of an appointment-driven process. And we reach out and say, hey, you got an appointment, can you make it on this day at this time? So I hear your point and I agree with it. I think what we've been trying to do is just to kind of keep people informed and let them know where they are. And it's getting to be a tad bit more predictable over the last couple of weeks. But I think that's going to, as the 65 plus folks come into the loop, that increases our pool, to Earl's point, which makes the time to get to that shot a little bit longer. But your point is well taken.
And can I also add something there? Sorry, John.
it's okay.
So the other thing that we're doing around, outside of encouraging as many people as possible to get pre-registered, is providing information on what's happening, right? Because people are getting inundated with newsletters and alerts, and they're getting conflicting information around where the state is versus where the county is. And so what we're trying to do through the CCCs and our network of folks is to be a conduit of the most up-to-date, short and concise information from the county to the community, and then vice versa, right? And so we have found that the biggest questions are, why is the state in tier whatever and the county is behind? And when we just educate people around just the sheer numbers of vaccines that we're getting, and saying, HHS only receives 30% of the total of vaccines that are allotted for the entire county, right? And that's somewhere between 4,500 to 7,000 some weeks, right? That was variable for a little bit. And telling people that in the 75 and older tier, we had 72,000 people to get to. So just the sheer numbers kind of put things in perspective for our communities, right? And then explaining the difference between where the state is versus the county, and then also explaining to people that there are other places where people can go get vaccinations. So like providing this information to folks has been really the other central role for the CCCs and the advisory groups is to just serve as that conduit of information.
So I want to quickly piggyback off of that and then address dealing with the misconceptions. First, Diane, I completely agree with you. I was on the CCC call, and honestly, if there's any slide that I feel like you all should put out on your website or everything else, I remember Sean posted a slide on our call where it showed the state, basically the flow of the vaccines. The state gets X amount, the county gets X amount, but then it's divided up into these different pockets. That to me was so eye-opening to best understand exactly what you said, Diane. So having that slide somewhere on your website really clearly, that would help. But to address, I'm just curious because there are so many people out there working, you know, there are like at least 2 or 3 vaccine hunter groups that I know of that are searching down. And on one hand, it's amazing that they're doing this work, but on the other hand, I feel like there can be some potential miscommunication. I know I shared with Sean a Facebook post that was shared that undocumented woman got an appointment at CVS and then was told that she couldn't get a vaccine there. And so that type of communication, in earlier conversations with Sean, we talked about that, yes, the county's willing to, you know, get as many people as possible, including those who are undocumented. Maybe that's the only path as opposed to pharmacies or hospitals or what else. How are you all managing it? Because I admit it's kind of a double-edged sword. You want everybody helping to get people vaccinated, but on the other hand, you're dealing with potential conflicts of communication.
Not only that, but we're dealing with when a story like this happens, and that story occurred in south of Waldorf in Prince George's County. It becomes regional, and then the word gets out. If you don't have the right documents, CVS won't vaccinate you. And I understand that state delegates in that area and will likely be following up with CVS and correcting the record, but that's something that we need to keep in our communications that we're going to need to address. That our Latino Health Initiative is going to need to address in our Latino media, as well as community partners who have members who may not be fully documented. But it's challenging to all of us and concerning to all of us. Diane?
Yeah, I mean, so that's one of the biggest things that we saw through the census, right? We had to do a lot of counter messaging, and we're finding that particularly in this moment, right? So having folks like you and the CCCs and the advisory groups, folks who can be trusted sources of information so that you can get it out to your networks as quickly as we get it to you, it really is the key to counter messaging. And additionally, when we hear things like that, move very quickly on it, right? And so we heard this come out and we met today about how we as a county need to do a better job of explaining to people that immigration status doesn't matter in vaccines and mostly anything else in the county, right? And so that's really the purpose of these CCCs, is to help us hear what's happening on the ground and to respond to it very quickly. So, you know, if you hear of any of issues, feel free to reach out to us so we can move on it very fast. And I mean, you know all of us pretty well, so.
Awesome. Thanks so much for your work.
No, thank you.
All right, a question in the chat, and then I'm going to come to you, Deborah. The question in the chat is, as high schools reopen, what facilities will the county use for vaccination? Older residents and others who are uncomfortable with mass vaccination sites prefer places closer to home.
Well, so first off, we've worked with MCPS. We're going to be out of the MCPS schools by April 1st. That's the agreement we have with them, because they're expanding, particularly additional students coming in, and we're expanding vaccination totals. We don't think the high schools are going to be ideal places. So we've been working with them, and that's sort of the current understanding. We are looking at a host of other sites. We looked at both the Montgomery College sites, whether the state does mass vaccination center or not. We will use the New Montgomery College Germantown campus for our own site if they don't. We generally agree. So basically, we want vaccine, even at the county distribution levels, to be a portfolio, just like you would have a stock portfolio. And that is, we want multiple community-based sites, but community-based sites are not great for pushing mass volumes of vaccine. They're much better for 50, 100, 200, 300 doses a day. They're not built for getting out 1,000, 1,500, 2,000, 2,500 doses a day. And so we need a balanced portfolio of getting out massive numbers of vaccine, because the state has already told us if you have vaccine left over at the end of the week, you don't get more the next week. So we have to use our vaccine up every week. And then we have to also balance it with getting it to where people are at, particularly in communities where travel or other things are a problem. And so we will be doing more of both of those things. We will be having more community-based clinics, but we will also be pushing out large volume through the larger vaccination sites. And it's just going to be a sort of a balancing of those two things constantly. There are these equity hubs and these mobile vaccination opportunities through the state as well. We are going to continue to advocate and look for those. I would expect to see more of those in the county as well. And there are also the opportunities through the pharmacies, which are required to be more community-based, focusing on vulnerable populations as well. So you'll see more of I think there was one in Friendship Heights a week and a half ago. You'll see these pop-up locations more readily throughout the county, being organized by the pharmacies most of the time, or the hospitals for that matter. So more opportunities at the community level, but also that's going to be balanced with these large sites just to make sure that we use up our vaccine every week.
Thanks, Earl. Deborah?
Thank you, everybody. So I just want to piggyback on this. It came to my attention that there are a number of people with disabilities, significant disabilities, long-term care, who are in the community and who fall through the cracks because they're not living in nursing homes, long-skilled facilities, or even any kind of assisted living kind of setting. People who sent their personal assistants home when the pandemic struck because they were afraid to have these people come in. People who there are just multiple systemic compromises that they have. So it raised a couple of issues that I just want to bring to your attention. The first is that the website, they said, has not been accessible. They haven't been able to maneuver. Even people who have access to, whether it's smartphones or computers, have not been able to use it if they're low vision or if they've got motor difficulties. Their assistive technology hasn't been able to use the website. So I would just ask that we make sure that whatever we're using and we're putting out to the community, that it be fully accessible, minimum ADA compliant. And then the second thing is, whether we're talking about our population of folks aging in place, or this long-term care or long-term disabled population who may not be connected to any particular provider group. Maybe they had jobs, maybe, and could afford their own assistance. They're all very, very isolated and having a lot of trouble just maneuvering around the system to access. They're afraid to go to the pharmacies. They're afraid some of them can't traverse because of mobility issues. So I just think that as we're looking at all of the other folks who are at risk, this is a particularly high-risk population, and we need to include them in our planning.
Thank you for that. I'll take the fully accessible webpage commentary back and have the team work on that. That's a great suggestion. In addition, if you're aware of any residents, they can actually call and they'll get assistance on the phone to pre-register as well. That's an option for folks while we get.
Yeah, they knew that. They were all. I mean, I tried to contain it, and I actually am or connected with a group that takes this on.
Mhm.
My concern is that there may be a whole group of people who we're not getting to. And it occurred to me as I was listening to the communication strategies that we may want to be very explicit about neighbors paying attention to neighbors who may actually need some of that assistance, because some of us are not necessarily aware of who may have had assistance, and those assistants aren't coming anymore, and things of that sort.
Okay, that's good feedback. And the other thing I will note is we did start a pilot last week that we will be expanding to do in-home vaccinations for people who cannot leave their homes. So the very old,
Okay.
those with disabilities. And so we have to get them pre-registered, because in the pre-registration is where we flag that they have developmental disabilities, or they're very old, or they're homebound for whatever reason. And once we flag those as being homebound for whatever reason, that's who gets shuttled into the program, where we're doing about 50 to 100 a week. So it's not like we can do it on a mass scale per se, but obviously it's, we will expand that effort as we have to get comfortable. We've gotten comfortable with doing a pilot with one partner, and then we'll expand it to other partners as we make sure that we've got all the infrastructure right.
Sounds good. I was just wondering, as part of the census initiative, is that a source of information about some of these homebound people, or people whose disabilities are sufficiently compromised that it would just provide us with a database of people for whom we need to make more of an effort for outreach under circumstances like these?
I don't know if that'll be Diane for the.
Yeah,
We have
Sean, that's a really good question.
So if the question is whether the information is available through the census, the answer is no, because that sort of information isn't asked. If it were asked, it'd be a part of the American Community Survey, and that's not comprehensive enough to get what I think we'd need.
Okay, so it's just to be aware then that this is, and just to know that this is the direction in which all of these long-term care, home and community-based service models through Medicaid are moving for people to stay in the community, which means that they're not necessarily connected to the provider groups in the way that, let's say, the developmental disability group home provider group has a cohort of folks that they are taking responsibility for. So as we attempt to capture as many people as possible, we need to be careful these folks don't fall through the cracks.
Yeah, and thank you for that point. We are
Thank you.
and we're very cognizant about it. We've been working very closely with our Commission on Aging folks and in the, as I'm pretty sure you're aware of, and in one of those meetings that are happening on a weekly basis. And we'll take your comments back, and I'll research the census data. That's one question I don't have regarding, one answer I don't have. I'll check on that for you.
Thanks. Thank you so much.
Do you have any more questions from anyone? And ladies and gentlemen, making an appearance this evening, the Montgomery County's own Chunky. If you look at Diane's camera here, and he doesn't want to be on camera apparently this evening, but there he is.
This is our new Office of Community Partnerships mascot. Say hi, Chunky.
And he's been eating very well, as you all can see.
And Elijah likes to ask for a special guest appearance from him every time, so he's very spoiled.
Yeah.
Well, Elijah, if you've got a name like Chunky, you've got a certain physique that you have to maintain.
Well, I don't know what came first, the dog or the name.
True enough. True enough. Folks, any more questions for Diane or for Chunky, perhaps? Maybe what his favorite food is? Hey, I know you all have been online all day, so, why not ask the dog a question? Easy crowd tonight.
He'll have to meet my puppy at some point.
Okay.
We have a pandemic puppy as well.
Oh,
Yay!
we're gonna hold you to that, Omar.
Yep.
Hey, Elijah, I do have a question. Hi, Diane. This is Peter. How are you doing?
Doing well, Peter. Good to see you.
Yeah. Question. We've been talking about vaccinations, but I also hear from the county where they're a little upset that people aren't getting tested as before. And I was just wondering, I know I put it in the chat, but I don't know whether you read it or not because I had to leave for a minute. Was that discussed? Are we communicating that people still continue to the need to continue testing, whether you're vaccinated or not? Because unless you test, the county has no idea what it looks like out there, what the picture looks like out there. And
Yeah, Peter, it's
I
a
think-
great. Oh, sorry, go ahead, Barry. I think we're gonna go ahead.
Yeah, we have been trying to communicate that as much as possible. It obviously gets lost in the noise of vaccine quite quickly. But I know at every week we do a weekly press briefing every week on Wednesdays for those who don't know. And at that event, we constantly, talk about the importance of testing. I think the word that Dr. Krall uses, words he uses is testing is our best shield against the virus. And it is our best way of protecting ourselves until everybody's vaccinated. I mean, it's great to see that, 14-15% of the population is vaccinated, but that's a large percentage that is not. So the only way, to your point, is to do that.
yeah,
So we try to continue that, and we talk about it often. And we're at least from a social media perspective, we're constantly putting out information about testing and where our testing sites are, the hours. We put that out quite a bit. So
I'm just saying that you have a community here that you put together that you have the opportunity to leverage to also communicate that message to the community. The Wednesday briefings is very tailored in that questions are only accepted from the media, and media questions are the only ones answered. So if you're counting on the media to spread the word, media will put out whatever the breaking news is for the moment is, as the media uses that phrase. But I think there's the CCC community here that you have here is a great leveraging arm that you can use to communicate that the need for continued testing, as well as getting vaccinated, and how to get vaccinated.
absolutely. Yeah.
And the one thing
Excellent point.
The one thing also, Peter, I would add is that the only way we're going to be able to screen for these variants is that we be collecting samples that allow us to get those tested as well. And so we've certainly been echoing that in our conversations. But I think, to your point, I think we can do it more and through.
I unfortunately had to go to South Carolina for a funeral. My wife's brother had passed away. South Carolina being South Carolina, we prepared ourselves. We prepared ourselves for social distancing, masking, double masking, you name it. But when we came back, we waited 3 days after we came back, just in case the virus was in us, and got tested, and we came back, the test came back negative, which was great for us. But, I test monthly. Once a month, I go and get tested. But because of this travel, it was a 2-week break in the test, a 2-week interval between the tests. But I'm religious in testing because I really want to give the county and Dr. Krall the data that he really needs. But, but we need the masses to do it, not just a few individuals.
Thanks, Peter. And, as you know, we've continued to try to stress that. And I am currently drafting my updates to go out to the CCCs. So I will make sure that we include that in our update tomorrow evening. Thanks, Peter.
Thank you all.
Fran?
Yes, I put this question in the chat, but I don't think it's been addressed. There's been talk of lowering the eligibility age for communities of color and others who are particular risk. For example, a 75-year-old African American who has comorbidities might be more like an 85-year-old than a 75-year-old white middle-class person who's had regular health care. And there was talk about lowering the age for groups that might be at higher risk, so they would get shots earlier. Has there been any progress on that?
Yeah, so I know Councilmember Juando has been talking a lot about this particularly, and we actually had a conversation with him directly on Friday about it. And a couple things. We haven't gotten all the way on the policy question of it because for a couple of reasons, but I think the most problematic piece of it is how the state would respond if we did it. And what I mean by that is, generally speaking, and this is with anything COVID related, you can be more restrictive than the state, but you can't be less restrictive than the state. And so right now the state is saying you can't, essentially we're focusing on 65 and older. And so I would have real questions about what the state would do to our vaccine allocations if Montgomery County chose to go outside the lines the state has drawn and include more people. Now, we're trying to get an assessment of that and ask the state just, whether we could do something like that. But I think in the interim, obviously the county is one of the few partners that actually has a racial equity strategy built into its vaccination. And so we're applying that. We just moved to the 65 plus and we're applying it stringently to our 65 plus population. One thing that we do have in our categories, in our 1C category, is those with underlying health conditions. And I would expect that once we start to become less equitable in our 65 to 74 population, we're going to be more rapidly moving into the next group with underlying health conditions to maintain that equity principle probably faster than we did with 75 plus. That was a learned experience that we need to move into those next phases so that we can be equitable more quickly and keep up because what we saw is basically, we were able to be really equitable for the first few weeks while we were in 75 plus, but then as the number of pre-registered Black and brown folks diminished, the vaccination efforts in the 75 plus population became largely focused on our white residents. And if we want to maintain equity throughout the process, we may just need to add other groups in sooner so we can maintain that equity framework longer and more stringently. In addition, the CCC is part of those efforts are to get more people pre-registered who fall into those demographic categories so we can go longer in those categories being equitable. But Earl Stoddard thinks it's a great idea to move into early groups for other things, but Earl Stoddard also wants to make sure that the state doesn't view it differently, and we don't jeopardize our vaccine totals as a result, if that makes sense.
Is there any reason you can't ask the state?
We have, and they haven't given us a straight answer. I think they were taken a little bit back by the question because I don't think it's something they've considered. And we're kind of waiting for feedback on whether we would get our hands slapped for doing it before we decide fully that we would do it or not. But we certainly are talking to Councilmember Juando and others about this issue, and it is definitely a way to be more equitable, and we agree with that. We're just trying to make sure, there's no policy decision. The county executive hasn't opined exactly how he sees it, but it is a very forward-thinking way, and frankly, would be incredibly, it would make a very powerful statement about how much we view equity as a principle. And so it is absolutely something we're talking about.
While I have the floor, can I ask one more question? Are you using the civic associations as a communication vehicle, or are you relying on us to do that? My guess is we don't have representatives on this group from every civic in Maryland, in Montgomery County. And certainly there's a list of those. I mean, there's lots of stuff that comes across my neighborhood listserv, but it's usually from John Smith says, I just registered at Venice, they got 100 slots, go for it. And by the time people get on, it's gone. But that's an individual as opposed to a systematic communication from the county?
So we are, Fran, I'll jump in and Barry can follow. We are putting out messaging through the 5 regional service center directors and through the council members. Council members receive the up-to-date talking points, things we want to push out there, and they send out to their list as well as we do in the executive branch. We also, one of Barry's people, or one of our public health, our public information officers for HHS, is regularly reviewing the comments on Nextdoor and in neighborhood listservs and correcting the misinformation. And there's a lot of it going out there, a lot of shared links. So not only are we pushing out information, but we're also actively looking for misinformation that we can correct. But I as a regional director, my newsletter, every edition, and tonight's edition is going out shortly, has updates on where we are with COVID and news people should know.
Is there any way to make sure that the people who get, who you direct your information to know they're supposed to share it? Because our neighborhood association doesn't seem to be doing that as a matter of policy.
We can include that message, of course. Please share important information. If you want to pass along on the QT to Diane and I what association you live in, we can reach out to and ask them to please circle.
Well, I was on the call with Ken and them last week or so, and I don't know whether everybody had whether the people that got to the bottom of the barrel on the list, but my wife and I both got our second shot today.
Yeah.
So, and it was great. I mean, I think that the system that we went to Richard Montgomery this morning, and it was a relatively smooth system. I mean, the people there seem to be committed and dedicated to getting you through. We had a little hiccup with my wife at the place there. They didn't sign her card. So, and we didn't notice it till we got back home, but I went back up there with her card and her driver's license, and they signed off and were happy to do it. So, I guess I can stop raising hell now, but I can keep sending out the message.
Did your sister-in-law, the 81-year-old you talked about, get hers?
She got the first shot. She should be due for her second shot coming up soon. So, and then I understand that the 103-year-old cousin of Pearl Green, who is his wife, grandmother, got her first shot. I think I understand. Julian had intervened in that and got that straight. So some messages are getting out.
Good. Thank you, Vernon. We're so glad to hear that. I'm glad to hear that Richard Montgomery was smooth, except for the one minor hiccup, but you took care of it, so it's all good.
Brother Ricks, I heard that you did 10 pull-ups after you received that second shot today. Is that true?
Well, it was 21. Yeah, it had to match my age.
Okay, I apologize. Brother Ricks got his shot, therefore you all should get yours as well too when the time is right, when you're called upon. He did 21 pull-ups today to match his age. So this is a challenge for the rest of you all to get your shot and then do the pull-ups that match your age. So I'm sure we're gonna have a bunch of 21s, 22s, 23s, 24, might have a 17 or 18 in there, good stuff.
I feel a challenge coming on.
That's what it sounds like to me.
And I think Elijah, being the chair, has got to lead that.
Yeah, I am. So that's right. That would be 14 for me, actually. So if you ask my wife, it probably would be 12, but
I have a question for Dr. Starter. This is Peter. If you all don't know, Harvey Ziegler is a longtime county resident. He just turned 101 this year. we were going to celebrate his 100th birthday last year, but COVID interrupted. But he didn't get his shot till significantly after the vaccinations had started. And I was wondering, what is the county doing in terms of really reaching out and identifying those people, like in Harvey's age, to capture them rather than, you know, find out that he didn't get his shot till just a couple of weeks ago.
Yeah, so to describe roughly what's happening is, you know, we're taking our pre-registration data and we're prioritizing certain zip codes and pulling names from those zip codes as a priority. And those zip codes are where we've had the highest both cases of COVID-19 as well as mortality or deaths per capita. And obviously, because those places are disproportionately our most diverse communities, we end up selecting heavily from our Black and Latino community because of that. And I don't know. I saw Mr. Ziegler. I know. I know he got at the East County site. He was there, and you know that made fanfare, and I saw that. But I don't know where he lives in terms of the zip code and whether that would have impacted why his name wasn't pulled earlier or not. Yeah, we're not going into the system and picking out names per se. I do think we did add in more influence for those who are older. So for example, we did this later in the process than we would have liked. So in the scheme of 75 plus, we should have started earlier picking the centenarians and working backwards from there. That was a lesson we learned a little bit too late, but I think that just describes the process that's generally used to pull names, from the system.
Okay, thank you.
Omar, you had your hand up earlier. Did you have a question?
Yeah, it's more of a kind of question comment. Actually, today I was on Nextdoor and somebody was sharing just information how they got their vaccine. And it was a whole paragraph thing. Pretty much they said, go to Walgreens, register, and then wait till midnight, and then go on the site, and then it'll pull up different vaccine sites or whatever, different Walgreens you can get it at. But I noticed, obviously the vaccine sites, I know where they are. I mean, one of them was White Oak. The other one was Adelphi and Riggs Road. And I know they're predominantly Black and brown areas. But I think that's, I don't know if Walgreens and CVS, if they have phone number systems set up, or, because honestly, with my staff at my restaurant, I have, 15 employees, and, everybody that I talk to wants the vaccine, and they've asked me, Omar, how can I get the vaccine? We're treating, we're dealing with customers that aren't wearing masks, because they're eating, so, I guess my question or comment is, with these pharmacies, is there any control as to, obviously you're hoping that the pharmacies that are servicing that community are actually giving vaccines to folks in those communities. And that's obviously not happening right now. We have people traveling from, much further away that can actually sit there at midnight and hit refresh or whatever they have to do for 5-10 minutes in order to get an appointment. But I think, it's like the states is giving these vaccines to these communities, but obviously we're finding out that they're not being given to folks in those communities.
So first off, you are correct in your assessment that I don't want to criticize too badly, but you are absolutely correct that there is a lot of picking a location and using that as a surrogate for being equitable, and clearly we know that is not what equity means. It's equity not just in terms of location, but it's also in terms of the process, and throughout the process, every step of the way has to be equitable. And candidly, if you look at our state vaccination sites, Montgomery County residents are disproportionately using the mass vaccination site at Six Flags far more than Prince George's County residents are. And it's not often exclusively or even majority are Black and brown residents who are utilizing the Six Flags sites, just so we're clear. So if you set up a process that's first come, first serve, you will not be being equitable. And I think the state has come to realize that. Now, the state system is set up so that there are literally probably 10 different places in Montgomery County that you can get vaccinated at. Pharmacies, hospitals, one-off opportunities, the mass vaccination sites, and the county sites. The county obviously really only has influence over the county sites. We have requested, and some of the hospitals have provided, they have followed our recommendations for groups and used our equity framework and such. But the pharmacies listen only to the state, and thus far, the state has not required them to be equitable, suggested they be equitable, or even had them develop a plan that reflects equity. And so that has been something we've been pushing for from the county level. All of our elected officials, both in the state delegation, the county representatives, have also suggested everyone who receives vaccine from the state of Maryland should be required to have an equity plan for how they're going to distribute the vaccine. And I think the state is coming around to that notion way too late. We're 12 weeks or more into this process. And it's just the truth of the matter. I think the vaccine hunters, I see the Google Doc. I was actually looking for it while you were asking your question, Omar, because that document is by far the best summary that I have seen of all of the vaccination opportunities across the county. And so I would encourage you to share that. That's something the vaccine hunters developed on their own. Frankly, it's a great document. It sort of summarizes everything that we, like the collective we know about vaccine opportunities, what time appointments go up on various locations, where you go to pre-register for them. This is not the system that we would have designed if Montgomery County were in charge of giving vaccines in Montgomery County or the state of Maryland. But this is the system the state of Maryland is currently utilizing. And so we all have to unfortunately play the game that is not fair nor equitable.
Yeah, because obviously, I mean, the Google Doc's not going to work for my mom. It's not going to work for most of my staff. That, first of all, it's in English. So there's a lot of people that are excluded. And obviously, we know what the issues are. It's just trying to come up with a solution for them.
Actually, the Google Doc you can translate into Spanish. The vaccine hunters are 50% Hispanic, and so they're very aware of the issues of language access. I'd have to say one of the weaknesses is they don't include other languages outside of Spanish and English. So if anything, people who speak Amharic or Mandarin or other languages will not have access. But I liked it because it has phone numbers. And so to the extent you can share that information, I think it would be helpful, as well as if you find information that you think should be added, because it's a live Google Doc, you can also share the wealth of information and put that in there.
Thank you.
Yeah, so today that Montgomery County made a move on appealing to the Black and brown community with a friend of mine who I worked with very closely back in corporate America, JB, James Brown. And I think that the thing was saying that he is doing COVID spots for him or what have you. So I was glad to see that, he's well recognized and, he's a great guy. He even has a degree in ministry. So I know him well.
Yeah, he did a spot. It was in collaboration with the African American Health Partnership. And I think that's, some of those kinds of community advocates are powerful, powerful partners in getting more. We're trying to partner with some of our churches and other organizations that are really deeply embedded in the community to try and get, address hesitancy, but also just get the message out through weekly activities like, sermons or, in our synagogues or in our mosques, trying to get people, pre-registered through that mechanism and get the word out about how they access vaccines. And so JB has been I've seen the ad. It's a great ad, and it's a really good, encouragement for people to get vaccinated. And I think that he's a really great example of the kind of person that will be a powerful surrogate for the county and for the partners to get people vaccinated in different communities as well.
Thanks. Fran, did you have another question or comment?
I did. I actually had, it was more a sad story than a question, but it is something that I think you should address with the state when you talk with them. I was on a call with the D18 group and Mark Elrich was on that call, and he reiterated that the vast majority of vaccines do not come to the county. They come to either the health systems or, you know, the like MedStar and whatever, Johns Hopkins, or to the pharmacies, to the drugstores. I got my first shot in District Heights in Prince George's County. I'm getting my second shot in Dundalk, Maryland. I have friends who have driven literally 3 hours past Deep Creek Lake to get a shot. There is also a climate crisis, and those unnecessary miles, when they add up, they make a difference. I know you're focused on COVID, but climate's a big issue too. And maybe, you know, I know Montgomery County cares more about that than the state does, but maybe you can raise that point as well.
Yeah, it's part of the reason why we've talked about the state should want us to have a mass vaccination site, because candidly, we're driving, like you said, we've got residents literally driving across the entire state. I've heard people going out to Wacomico County. I've heard people going out to Washington County. So literally polar opposite ends of the state to try and get vaccinated. We can see on our list people, like there's like 80 people who have gone to Denton Walmart to get vaccinated. Like we can see each of for a Montgomery County resident, we can see where they've gone, and it is, people are finding opportunities, but you're right. From a climate perspective, but also from the fact that like no one should have to drive, 100 miles to get a, life-saving implement.
Well, and when you add that on to the equity implications, you can't drive to Western Maryland if you don't have a car.
Yes. No.
So it just
Absolutely.
seems like this has been the absolute worst system. I know Montgomery County's hands have been tied, but I really appreciate people like Will Jawando who are trying to figure out how to do it better. But I think a lot of this is decisions that the state is not making and ought to be. And so maybe you can talk with them.
And we're trying to work where we can. So for example, I know Councilmember Jawando has been talking to General Burkett, who's the equity lead for the state for COVID-19 vaccination. And I know he has expressed some agreement with Councilmember Jawando that there are some things that we need to do where we need to do more. Like I know, for example, the state has essentially said, hey, we may have an opportunity where we can do mobile vaccination sites. Do you have places in our community where we could target? And we've been working, we're trying to, this is not the state, like I said, this is not the system we would have built if we were building a system. There are lots of problems with it. We're trying to push on the system and also make it work for us as much as possible. But you are correct that there are a lot of problems with how it's been set up that will be very structurally hard to make work even as we try to do it. And the fact that people have to drive across the state to get access, it's a problem, and it's going to exacerbate these equity concerns.
Plus the cost of gas has gone up to $2.70 a gallon now at the minimum, you see.
And brother Rick's got a Porsche, so he got to pay that expensive gas price too. He got to pay that premium, that 93. That's over $3. We can't have that.
Oh, you didn't hear? He just got a new car. He got a Rolls Royce now.
Oh, well,
He
see.
just got it.
No, well, the Bentley takes it.
Bentleys and push-ups. I want to be like Vernon when I get grow up.
Appreciate that. Do we have any more questions this evening, folks?
I have one more thing that I just want to point out. Early on, I put in the chat that John Barry, who wrote the book, The Great Influenza, he's a college friend of mine. He's speaking at the WDC. It's open, everybody can come, it's free. but you have to pre-register. I would think that every one of us would want to hear from him, because what he's talking about is what are the lessons from 1918 that ought to be applied here. And one of the big ones, his top lesson is tell people the truth. And I'm not accusing you all, but I sure am accusing people at the state.
John Barry's book is probably the seminal pandemic book that I've ever read. And so I looked at my schedule, and I'm going to try and clear out my 1 to 2, I think it is, on Wednesday, because
that's
it is absolutely must see TV to hear Mr. Barry. I read the book when I was getting my master's in public health at Johns Hopkins. It was required reading at Hopkins. And there are anecdotes, there are lessons that we as a society did not learn from 1918 that we should have learned before the pandemic. There are mistakes that we are repeating. There were anti-maskers in the 1918. They opened up things too quickly between waves of the pandemic and made the second, like, there are so many mistakes that have been repeated that one might not have repeated if you had read the book. And so I actually can see it on my shelf where I sit right now. And so I would definitely encourage anyone who can attend to do so.
Can I just say one final thing, Elijah, before we wrap up? I just really want to thank all of you for your involvement around the census, and now as we're working through the COVID recovery and response. Our success for the census and making sure that people get vaccinated is not going to be successful without people like you. So keep the ideas coming. Shout out to Up County subcommittee who came up with the Be Counted idea for the census, which is now the Be Healthy campaign that you're seeing. Thank you to Vernon and other community members who are making sure that folks who need to get vaccinated first get pulled first. So please continue to reach out to us, continue to engage with us, continue to give us information, and we're here to facilitate whatever you need to get information to our communities.
Thank you, Diane. We certainly appreciate your work. You know, Ken, Sean, Barry, we know that you all are working tirelessly in addressing this issue. So we owe you all a huge debt of gratitude for the amount of time that you're spending on this. So we thank you for taking some time out this evening when you could have rightfully been resting instead, for coming here and answering some of these questions. Please make sure that you all are taking time out to find time to rest. But thank you so very much for all of your work. Much appreciated.
Thank you for your work as well.
Thank you.
Thanks, everybody. Have a good evening.
Yana, we're gonna go back over to you before we close. We'll let our guests go and we'll come back with you.
Okay.
Sure.
Well, good night. Oh.
Good
Just
night.
before we wrap,
Yeah, everybody.
please save the date for our next meeting, which will be Tuesday, April 6th, and I'll send out a follow-up email.
Great. Thank you.
That's it. All
Good
right.
night.
Do
Thank
you know the
everyone.
topic? Adriana, do you know the topic yet?
Not yet.
Thank you.
All right. Take care.